Good morning and welcome to the 18th meeting of the Health, Social Care and Sport Committee in 2025. I've received no apologies for this meeting. The first item on our agenda is for the committee to agree to take items 5, 6 and 7 in private. Are members agreed? The next item on our agenda is to undertake periodic scrutiny of the work of the Care Inspectorate, and I welcome to the committee Jackie Irvin, Chief Executive, Edith McIntosh, Executive Director of Assurance and Improvement, Adults Registration, Complaints and Quality Improvement, and Kevin Mitchell, Executive Director of Assurance and Improvement, Children's Regulated Care and Strategic Scrutiny, all from the Care Inspectorate. And we will move straight to questions, and I'll start this morning. So I'd be keen to hear how the scope of your work in relation to social care changed since the Care Inspectorate was established.
So that I've only been here nearly 3 years, so that was before my time.
Yes, it's changed quite considerably, to be honest. I went to the Care Inspectorate in 2011 under a transfer from what was then Her Majesty's Inspectorate of Education. In terms of the focus of our work, I mean, the legislation has largely remained unchanged. It's still the Principal Act that we, the key principles of the Act that we adhere to. But one of the biggest changes of scrutiny, if you like, in terms of regulated care services was in relation to quality frameworks that we introduced beginning in 2018 with care homes for adults, and we've now got a quality framework for every care service type. Now, again, just very briefly, if it's helpful to the committee, the framework is principally a document to support self-evaluation, but we also, in the interests of openness and transparency, use that document as the foundation for our scrutiny work. And indeed, it reflects health and social care standards, so they're kept under regular review. But the most significant part of that was the very, very deep and firm focus on experiences and outcomes. And that is entrenched throughout all of the frameworks, so that we, regardless of structures, regardless of changes, we hold firmly, and regardless of the challenges, and we know there are many for regulated care services and indeed social work services and around, but regardless of the challenges, whilst we will contextualise our findings, we hold dear to the firm commitment to report on experiences and outcomes for people. And the frameworks also enshrine the health and social care standards, therefore a rights-based focus. We hope that in due course will be strengthened in terms of an even stronger focus on a rights base. But that's been the significant change. The services themselves, of course, have changed significantly, not least since the pandemic. They have challenges of their own in relation to recruitment and retention, and indeed cost of living. We've seen that over recent years, and more recently national insurance charges. So there is a context, there is a complexity. Services respond to needs of communities. We've seen services get larger, not smaller, and that brings a level of complexity. We've seen staffing pressures, quite acute in some areas, and I'm sure that may be an area that you want to explore. In terms of the services, we've had more asked of us, which is good. We try to be helpful and supportive and do what we can with the resources we've got. We've most recently got child contact centres. We took over responsibility a number of years ago for adult support and protection, and we took over responsibility, which wasn't right away when the Care Inspectorate was formed, for the inspection of social work services, including justice social work. So the role has expanded. The context is significantly different. The challenges are there. There were, I suppose, challenges you could argue that were always there, but they change with the times. But again, I think one of the strengths of our frameworks and approaches is we commit to supporting improvement through all our work in terms of the frameworks. But primarily, the legislation requires us to provide independent assurance. And therefore, whatever the context, whilst we will contextualise our findings and give credit where it's due, we hold firmly and dearly to the responsibility we have to report on experiences and outcomes for people, and in some cases, some of the most vulnerable people.
That's really helpful in terms of setting the context of the sort of broad range of your work, right through from our youngest to our oldest citizens, when they come in contact with services that you monitor. I was going to ask a little bit about your key corporate priorities, and to what extent you've achieved those over the last 4 years, and what hasn't been achieved and why.
Thank you for the question, and thank you for the invitation today. So our key corporate priorities are within our corporate plan, which is actually coming to an end this year. I read the corporate plan in my introduction to applying for the job, and I thought it was fairly extensive, very broad-ranging. So we are moving into agreeing with our board through a process of consultation with our workforce and the providers, a new corporate plan for 5 years. A number of those things will continue, and I think the broad headings of our priorities will remain the same. So high quality care, realising the rights of people who experience care, and obviously supporting our workforce to be as skilled and as adept at doing the inspections as they can, and doing the scrutiny and improvement work. So there are a number of things that they will run. We've met with our board already, and they're quite happy about those priorities, but just further developing them, and I suppose making them more fit for the future, because we have seen a lot of changes, as some of which Kevin has outlined, but even more recently. So it's about making it more flexible, and I think we will also this year be looking at developing a business plan to go alongside our corporate plan, so that we've got a way of reporting on how well we've done from year to year, as opposed to having a standing corporate plan for 3 or 5 years. We want to do that business planning process that we can actually then account for it. And clearly, one of the biggest pieces of work in rewriting or revising that corporate plan will be about looking at our key performance indicators. I think we've acknowledged that they need to be updated and much more performance-based. So they've worked well for us, but a number of them are in green, so you then question whether they are the right performance indicators for us. So those performance indicators will be developed once we've got our priorities, the plan and the detail of the work going forward.
So obviously that's pretty high level stuff, talking about KPIs and performance frameworks and business plans, etc. So getting down to, I suppose, a little bit more into the nitty-gritty of the work that you do. So I'd be keen to hear what mechanisms you have in place to allow the board to alert or to advise Scottish ministers on sector-wide issues should you see patterns begin to develop.
I think one of the things that we are very keen to do and have done all along, but we develop other options to do that, is about what the sector makes of us and how effective and efficient we are at providing that oversight and assurance. So we have developed, we've had long-standing questionnaires of providers called inspection satisfaction questionnaires. We've actually developed them more recently so that sorry, maybe not being clear.
Not being clear in what I'm asking here. So what I'm asking about is the mechanisms that you have as an organisation to raise concerns with Scottish ministers or with other authorities about concerns or issues that you might see developing.
So we obviously raise concerns with our board, particularly in relation to what we're seeing in terms of themes developing across inspection and assurance. And we raise that with our sponsor team as well. And obviously we work, as you'll probably be aware, Convener, we work to a number of different directorates in the Scottish Government, so we have that separate conversation. Although our sponsor team obviously covers everything, we then obviously, you speak to ELC, Justice particularly. We've had, for example, an issue in the last 2 years that we picked up, which was about supported accommodation for offenders, and that needed to be more regulated, and that was one of the things that we raised through those various channels to say this is something we need to do, and we actually stepped in to do it without any funding or anything because it was of such a serious nature.
Thank you very much. Emma Harper.
Thanks, Convener. Good morning to you all this morning. I'm interested in some questions around how inspections are actually carried out. And my understanding is that there's a cyclical approach to inspection that it was changed from cyclical to risk-based approach. So I'm interested to understand how the Key Inspectorate identifies risk, and is there a danger that this can sometimes be too late if problems have already been reported? And what kind of data and information do you use to identify high-risk services?
So I'll maybe talk about the change that we made from cyclical to risk-based, and Kevin can talk about the data, if that's okay. So in 2019, I think leading up to 2019, we had a cyclical approach to inspections, which meant we went around the country in a set format. And what we recognised, and actually the Cabinet Secretary at the time was also of the view, was that if we go in and provide an inspection and we set recommendations or improvement actions, we weren't seeing whether they were implemented or sustained until the next time we went in to inspect. So we moved to going in on follow-up and making sure that those recommendations had been enacted, that we could see evidence that they were working, that the improvement had been made by the service, and obviously the more difficult thing, they've been sustained by the service. In terms of a risk-based approach, we were aware at the time, and since then it's been reinforced, that you might have certain services who might not be due for inspection, but you pick up information and data. So we pick up information in relation to our complaints from the public, from the workforce about services. We also might know some soft information about just changes to organisations in terms of their management structure. There might be staffing issues. If we pick up those things, then that tends to add to our risk analysis, and that then might prioritise that service to be inspected ahead of another one that might be planned that week. So it's about balancing that risk and getting in, and we do get in very early. If we have a complaint, for example, we can decide to go in there and then and do an inspection based on that complaint to investigate the complaint, but you're still doing an inspection. We also get notifications about various incidents which providers are required to tell us, and we use them as well. So an inspector will see how many notifications, whether there's a spike in notifications, whether there are some that are very concerning, and in which case that would prompt us to increase the risk level and go in sooner. Changes to, I guess, what you're hearing on the ground lead to then unannounced inspections. Yeah. I mean, most of our inspections are unannounced, but even if they come in, if we're following up a risk or an accumulation of data and information that we think indicates there's risk, then we will go in unannounced as well. Okay. And in terms of, I think my understanding is also that places can do these self-evaluation questions. So how does a self-evaluation translate into satisfactory or excellent?
Yeah, I mean, we very much encourage services to use our frameworks for self-evaluation, as I mentioned at the start. We go into the inspection and we will gather any self-evaluation material that the service has done. I think it's important to say that self-evaluation for improvement, there has to be a name to it, and clearly that's why we promote self-evaluation as a means of ongoing improvement and not something you do just for inspection. But if services have been doing that work, we will look at it, but more importantly, the self-evaluation that we look at, we expect to see that it's evidence-based, because again, that's sometimes a failing. If it's evidence-based and people can show us that evidence, we will take that into the inspection, but we don't set out to compare our grades against the grades of the self-evaluation. If indeed a service has attached grades, many don't attach the grades to it. What's more important is they identify for themselves the strengths, their areas for improvement, so that they understand themselves, not necessarily waiting on inspectors to do it. But if they have done that and they can show us that self-evaluation evidence, we will give due recognition to that in the report and take account of it once we've effectively validated what they've provided to us. But it's critically important, because if inspection only comes round every so often, self-evaluation is a much more powerful tool as long as it's done on an evidence basis and it supports improvement. And for a scrutiny body, we would need to find a mechanism, and we do find a mechanism, to validate it and don't just accept something at face value.
And just to pick up, and you say, like, every so often, there's a lot of care homes, there's a lot of family contact centres, there's a lot of inspections that we need to do. What does every so often mean?
Yeah, well, Jack Irvine described to you the shift in the business model. We introduced that in 2019, and it was pretty helpful that we did, because we didn't know the pandemic was about to face us. And what happened to the pandemic essentially was we accelerated the pace, because we have finite resource, and we aim to make the best use of that resource, target it to where it's needed the most, and the risk-based approach, targeting the resources, returning to services quickly to make sure improvements have been made, but also made and sustained over time. So again, that approach enabled us to do that, and we built on that through the pandemic and coming out of the pandemic. Now, clearly, if we are going into services instead of a cyclical approach, which means that for some services you're just going in because it's their turn, we have to be conscious, and we are conscious, that we have to keep in the background a record of when a service was last inspected, so that we don't let it go too long without an inspection. So there is a tricky balance with the resources we have, but with public finance, we're committed to making the best use of the resources. The risk-based process allows us to do that. It allows us to follow up requirements that we make more quickly, to ensure improvements are not only made but sustained over time, whereas previously they were often not followed up until the next inspection. So again, there's a balance to be struck, but it is a challenge. I wouldn't pretend it otherwise. But again, we aim to make the best use of the resources and target those to where we can have the greatest impact.
Okay, and just a final question is, does the Care Inspectorate delegate responsibility for quality assurance to local authorities or integration joint boards? How do you work with other partners in order to implement inspections or then deliver the changes required?
I'll maybe start off, and maybe Edith could come in. First and foremost, primary responsibility for improvement rests with the services themselves. But we aim through our scrutiny work, rather than just a tick box regulatory approach and going around with a clipboard, just for argument's sake, we aim to improve, we aim to support improvement during all our work. So how we do that is we signpost good practice. We'll give some advice. We'll signpost to our website where there's good practice. We might even put them in touch with another service where we know that they've dealt with an issue more effectively. So we do that through the inspection work, but we also have targeted improvement support. So we will provide, it's a limited resource, but we will provide targeted improvement support where we think that can be helpful. We might do that generically across a particular area of our work, or we might even do it with individual services. For example, in early learning and childcare, if a service is at risk of not meeting the national standard, we will take them onto our improvement programme specifically aimed at that, to try and ensure that they maintain or retain the national standard and therefore the funded element of childcare provision. But Edith, maybe you can...
Yes, I'm happy to add to that. Thanks very much, Kevin. So Kevin's explained a bit around our quality improvement support process, and we do have a couple of teams with improvement advisors that support improvement. But I think both Jackie and Kevin have already said this morning that all of our work focuses on outcomes for people and supporting improvement, and that's our primary aim, although of course where we see care that's not good, we wouldn't hesitate to take action. But Kevin's described the early learning and childcare component, and that's a grant-funded piece of improvement work that we've been doing for a number of years now, and actually I think we've probably worked with around about 500 early learning and childcare services through that improvement work and seen a difference in terms of the experience for children. Another example of our work is around the Care Home Improvement Programme, and that's a really targeted piece of work, of improvement work, whereby we work really closely with our colleagues in inspection, and we target services that have got grades 3. We've worked with Greater Glasgow and Clyde, and we've most recently worked with NHS Teesside and NHS Fife in terms of the areas that we've worked with. So in the first cohort of the Care Home Improvement Programme, we had about 30 services involved, and we've already seen a difference when inspectors have gone back out to these services in terms of their grades having improved. So that's just an example of how we target our quality improvement work to support services that have a particular outcome in terms of their inspections, and we've seen a real difference. What we've seen when we've involved these services is a real appetite to improve. So, you know, a real dedication. You know, I'm sure the committee members know of the challenges that are out there in the sector at the moment. But despite these challenges, services are keen to make improvements where they need to make improvements, and we've really seen that in the work that we've done.
Just finally, just for the record, can you tell us what the grades are? You know, is it grade 1, grade 2, grade 3, weak, unsatisfactory? Tell us what that is.
I mean, there's a 6-point grade scale with unsatisfactory being 1, weak being 2, adequate being 3, and that was the grade that Edith was saying. If we have care homes that tip into that adequate, then they would be primary priority for that care home improvement programme. And then obviously good, very good and excellent. And across our services, in relation to those grades, we obviously keep account across all of the range of things. And you know, as Edith has pointed out, people are keen for improvement, but we see a lot of really passionate, committed, dedicated work out there when we are in inspection. So whilst they have challenges, you know, we see that, and about 87% of services across Scotland are achieving grades of good, very good or excellent.
Thanks, Convener.
Brian Whittle.
Thank you, Convener. Good morning. I just a sort of supplementary to my colleagues' questions there around self-evaluation. Totally understand where self-evaluation sits with those organisations who are looking to deliver the highest quality services that they can. Totally get that. I think we would recognise that the vast majority of those services, that's their attitude. I think the concern would be, we all know there are those who would try and game the system. How you ensure, you know, that these self-evaluations doesn't prevent you or you know, push back a potential you know, visit. And secondly to that was, in terms of developing this self-evaluation, was that in any way driven by finance and investment, you know, in terms of, you know, your ability to deliver what you deliver?
Take that one if that's okay. I mean, I think in terms of self-evaluation, we don't mandate that everyone has to do a self-evaluation. That's for, as you say, those services, and as I think we've pointed out, that are keen to do that, to look at their own improvement, to prepare for inspection in some respects. So they're preparing their view of what's going well, what needs to improve. But we, the point to make is that we do validate those. So by doing a self-evaluation, it doesn't prevent our time that we're going to go and inspect. We don't say, well, we'll not inspect them. We go in and we look for the evidence. And sometimes areas are disappointed because ours might not marry up with their view of their service. And that will be fed back to them, and the reasons why and the evidence why we don't think that we've adhered to that. And obviously in other times we would agree with their position because we've seen the evidence. One of the crucial things for us, I think, is about our confidence in an area or service's ability to improve. So if you're open and transparent to the fact that you've got improvement to make, then we would be much more confident. If a service is, you know, getting into a position where they don't think they're going to improve, that would concern us, because, you know, we are an improvement agency. We all know that we need to improve as we go along. So there's no way of avoiding an inspection because you've done a self-evaluation. But we do encourage services to do that because it gets them and their staff acquainted with the quality indicators that we use, the evidence we're looking for, the kind of examples of good outcome-based practice for service users, people who use and experience those services. So I hope that reassures you in some way. And to be fair, it wasn't driven by finances. Come back to the beginning of your question. It was really about services saying, well, how can we best place ourselves to improve? And that's why the quality frameworks have really done their job in that respect.
Thank you.
Ohani.
Thank you, Convener. I don't expect you to know about every single inspection that you're undertaking. But in 2023, you went to East Park School, which is in my constituency of Glasgow, and rated them very good. Now, they're under threat with the financing as they look after very complex needs children. There are obviously other places that you go to visit where that rating is not as good. So my question is, do you think your inspections, when they get ratings, sort of skews the way funding goes, where poorly rated schools or poorly rated places get more money to bring themselves up, and yet those very well rated might find themselves squeezed because they are so good?
Answer that. So we have no impact on what funding an organisation might get. We are aware, however, for regulated services who are being commissioned, for example, by a local authority, Health and Social Care Partnership, sometimes their commissioning of each local authority will be slightly different. So they'll look for a grade of good or above for the commissioning. That's just an example. Obviously, people commission on a different basis. They'll be looking more at qualitative, outcome-focused basis. But that was a very sort of blunt instrument of saying you need to have a grade of good. So I don't think it would impact on... I know East Park, as a social worker, I've placed children there, so I'm very familiar with it. But we wouldn't have any impact on that. So I mean, obviously, a place like East Park will have a board, I presume a board of governors, and the board might take messages from our inspection in terms of they might be concerned about the quality, and therefore, but I would think that actually would sort of inform the need for reinvestment or investment to bring up improvement. But that's we've got no impact on that.
Thank you.
David Torrance.
Thank you, Convener, and good morning to witnesses. My questions are around complaints and data collection. So how does the Care Inspector decide what complaints to investigate and prioritise?
Question. Thanks very much for your question. So I'm sure the committee is aware that we're quite unique in terms of having a complaint service in a regulatory body. We believe that our complaints functions really, really well, and we've done a lot over the years to ensure that the public understand how they can make a complaint if they wish to do that. We do gather a lot of data because of our complaints. So over the last number of years, complaints have risen. So at the moment, roughly we get in around about 6,000 complaints a year, slightly less over this past year, but usually it's around about 6,000. That's risen over the last number of years from around 2,800. So, we do believe that we're doing a good job in terms of being able to promote the opportunity to complain. The information that we receive in terms of our complaints is really, really important. We obviously have a system whereby we risk assess our complaints. So we have pathways that we use to resolve complaints. So that could be from using the information and data that you refer to as part of our risk assessment process in terms of inspection. And it might go all the way to doing an investigation and then perhaps an unannounced inspection if we believe that there's systemic issues that we need to look at. So the information that we get from complaints is critical in terms of informing our inspections. So Kevin spoke previously about that risk assessment process in terms of our scrutiny work, in terms of inspection. If through our complaints process we identify issues that we believe need to be looked at through an inspection, that would then mean we would reprioritise some of our inspections because of that complaint that has come in. So it's really critical in terms of the work that we do across the board. It also informs our quality improvement work as well. We know that in terms of trends around our complaints. So our report that came out for 24-25 was fairly typical of previous reports in that the trends tend to be around healthcare issues, and the most complaints are around care homes for older people. So the sort of three top trends would be healthcare issues, then communication, and then staffing. So, for example, some of the data from the healthcare issues, we might then work with particular services around these issues. So an example of that would be medicines management, and we've done a lot of work around psychoactive medication in relation to supporting people with dementia. So the data is really, really critical, informs our scrutiny and quality improvement work, and also obviously we can then report and share that data with relevant people in terms of where the issues are in relation to care.
Community United just add a bit to that. It's important to say that we get complaints obviously from care families, relatives, etc. But we also get complaints from workforce, from staff in our service, and we've got a duty to protect their kind of anonymity in that, and so that they're not at any risk in terms of their employment. So they're the two main bits, mostly family, relatives, and friends.
I was just coming on to that question. How does a care inspector perceive any changes in the type of complaints it received and the number of complaints over the last few years?
It tends to be the same type of complaints that we get. So, you know, the healthcare issues, and it tends to be primarily around care homes for older people. So an example would be, so in terms of visiting, issues of visiting within care homes, that's a really small percentage. So currently it's around about 1% of all complaints. So that's a bit of an example of, you know, the range of issues that come in. As I said before, healthcare issues can range from medicines, from tissue viability, nutrition, continence. So they're always at the top of the list in terms of our annual report.
Can we...
Could I just add, Convener, if it's okay? When I came into post too long ago, we were dealing as an organisation with around 2,000 complaints a year, and we're now dealing with in the region of 6. Now, when the media see that, the first thing we get, so care has got so bad? Absolutely not. I think people know where to come to. We did a lot of work over the years to profile our responsibility. It's actually unique in UK regulation for none of our bodies have that responsibility. We value it dearly, believe it or not, because how a service deals with a complaint tells you a lot about that service, and therefore we risk assess them, we triage them, and we give the services that we know will act responsibility, because if your loved one is needing something that's immediate, the best way to get that is a phone call to the service and confirmation it's been done. So again, we'll risk assess and triage them, but again, we'll fully investigate them when we have to. But it's a valuable tool. I would hate to lose responsibility for complaints, because it's got a richness of evidence, because every complaint we regard it as an opportunity to improve, and it tells you so much about that service in terms of the leadership and management, in terms of what they do, what they do with it and how they deal with it, and we get confirmation of that, and ultimately it's about supporting that improvement.
In the care inspector written submission to committee states that it upheld 73% of the complaints it investigated. What happens to the result for this for the complainant and the services concerned, and how does a care inspector monitor any progress or actions taken?
So any complaints that are upheld, we publish that on our website. There's always a response that goes to the complainant. We always have a conversation with the complainant. Unless they complain anonymously, then it's slightly more challenging, obviously, to resolve that issue. But any complaints that are upheld are on our website for the public to see. In terms of monitoring any improvements that might be required in terms of complaints, we would do that through our inspection process. As I've said before, you know, any of that information and data then gets put into that process of risk assessing services across the board. So we would monitor that in terms of our inspection process, and through that inspection process, if improvements are required, we also do follow-up visits to services to ensure that improvements are made.
Can I maybe just come in to say, Edith touched on the issue of anonymous complaints. Very difficult for us to deal with, because quite often when we get a complaint, we'll contact the complainant and just be absolutely clear what the headings of their complaint, what are the main issues. So if you've got an anonymous referral, you can't do that. It doesn't mean you can't investigate, but you've got no way of feedback or clarifying exactly what the issue is. We've done a lot of work in the last year in terms of trying to promote the idea that you can make a confidential complaint. So you don't need to, we will guarantee we won't share your details, but allows us to have much more of an engagement with that person who's making the complaint and obviously address the matter much quickly. And that's having a good result so far, and we monitor that. So we obviously monitor what types of complaints we get in, whether they're anonymous, and there was a fairly significant number 2 years ago that were, as we've done this improvement work to make sure that people can complain confidentially, and that appears to be working. We've done lots of poster work campaigns about that, so people are, and we've advertised that obviously in services and in various places.
Around data collection that you gather, how does the Care Inspectorate contribute to national picture and policy and to improve social care in Scotland, and especially engage with the Scottish Government?
So I think, you know, the best way to say that is as we gather our information in relation to quality. I mean, obviously I've said 87% are doing really well, but when we also notify the sponsor team and government of any particular incidents in relation to risk that happens in a service. I see them coming across my desk, which is a good way of, or my tablet, is a good way of me as a chief exec keeping a sort of note on what's prevalent at the moment. So, you know, at Christmas a couple of years ago, there was quite a number of cases where older people were able to get out of a care home, obviously into cold weather, very highly risky. And we've obviously reported on children leaving nurseries unattended. And again, they're notified up through government so that the ELC division director will be aware of that. And we then look at, well, what can we do to support that, to prevent that? Because obviously one child leaving a nursery is one child too many. We have seen the numbers coming down, but we'll put in guidance. We immediately visit those services where that's happened to look at what are their processes for keeping adults, older people, young people safe. So that's the way we use that kind of information. It's not necessarily a complaint, but it's a notification to us that something has happened, a serious incident has happened.
No further questions.
Patrick Harvey.
Thanks very much. Can I just check that you're hearing me?
Yes, we can hear you, Mr Harvey.
Thank you, Convener, and good morning to the witnesses. I wonder if you could just say a little more about the patterns of complaints that have come in over the years, whether that's changed, and particularly the public expectations, I think, and relationship to care services may have been affected quite significantly over recent years because of COVID. Have the events of recent years changed the kind of issues that people have concerns about, that they raise complaints about, whether or not those complaints end up being upheld?
Thanks very much for your question, Mr Harvey. I suppose just to repeat what I said before in terms of the trends of complaints, we haven't seen a huge difference over the last number of years. They tend to be at the top around healthcare matters, then usually around communication and then around staffing. I mean, there are a range of complaints that come in. However, these tend to be, in terms of the trends, the top three. I suppose one of the issues that's become a bit more prevalent as a result of the pandemic are the issues around meaningful connection for people and around visiting. Although I said already that actually we don't get many complaints, just around 1% of all our complaints are around that. That was certainly one of the kind of main challenges in relation to complaints during COVID and towards the end of COVID, was around people being able to have that meaningful connection with their loved ones and being able to have citizenship in their local community. And certainly we've done a lot of work around that over the last number of years, and funded through Scottish Government to run our Meaningful Connection programme, where we've developed resources and guidance and fact sheets around that. And obviously the two additional standards in the health and social care standards mean that services need to comply around visiting in addition, and we obviously look at that on inspection. So I suppose that's an example whereby we haven't had a lot of complaints recently, but it was probably more of an issue during and coming out of the pandemic, and where we responded to that, and actually we were able to support services, and we continue to do that in terms of that meaningful connection for people. And you know, we listen to those loved ones of people as well, in terms of being able to understand their feelings around visiting a meaningful connection. And we all know that being able to have that connection is so important in terms of our health and well-being, and being able to enjoy life no matter our situation.
Yeah. Thank you. The reason I ask is I recently visited and had some conversations with a care provider in my own region, and they were making the point that their experience is, and perhaps you can confirm that if this is more widely felt, that people are entering residential care later as a result of the changed attitudes and the experiences that happened over recent years. And if they're entering residential care later, they're more likely to be entering at a more advanced stage of conditions, including dementia and others. That's presumably going to change, if it becomes an established pattern, going to change the pattern of complaints and concerns that people have. I'm assuming that there would be more likely to be complaints from concerned family members about domestic or about residential care services than care at home. Is that right? And is that something you anticipate continuing to be a changed pattern?
So I think that is reflected in terms of the complaints that we get now. I think you're right. I would agree with you and acknowledge that those people coming into care homes now, into older people's care homes, their situation is much more complex. Often they're at end of life almost by the time they come into a care home setting. So the challenges for the care home and the staff in that care home are even more significant, whereby they're having to support people well, even though they have comorbidities and really challenging situations, and supporting many people at end of life. I think a lot of the data tells us that within a care home setting, many people are being supported to end their life there rather than in a hospital. So they have to have a whole host of different skills in terms of supporting people at end of life, dealing with many different health conditions, and dealing with, as you've already said, people living with dementia. So the social care workforce do have many challenges, and I think that our complaints at the moment actually show, in terms of healthcare, that these comorbidities are there now, and the complexities are there now.
Thank you. My last question is about complaints that are not upheld. You've given us the statistics about the proportion that are upheld from the complaints you investigate, but I wonder if you still take into that kind of wider sense of intelligence gathering any lessons from the complaints that are not upheld. Do they tell you anything about, even if that there isn't something to investigate, the concerns that people have and the experiences people are having?
We would use information from all of the complaints, including those that are not upheld, in terms of our wider scrutiny work. So, although they're not upheld, that information is put into what we call our scrutiny assessment tool, and we use that then to assess services. So none of that is lost, absolutely not, and we would always use that information to look at our wider scrutiny work.
Thank you very much.
Elena Whittam.
Good morning to the panel. The Care Inspectorate's vision is for a world-class social care and social work in Scotland, where everyone in every community experiences high-quality care, support and learning tailored to their rights, needs and wishes. I'm wondering whether this vision is going to stay the same in terms of your new corporate plan that's going to be coming forward. To what extent has this vision been achieved so far, and are there any barriers in the way at the moment of achieving this vision?
So if I could take that question, thank you for the question. It is actually something that we're very much looking at, obviously, in reviewing our corporate plan. And I think what we've always strived for is high quality care and equal access to care for people across the country. So the vision will still remain aspirational. It would be wrong of me to say we've written already, because we are engaged in consultation with our workforce, with providers. And I think a question has been risen about how do you measure world class? Because we know from our provider organisations, the other regulators across England, Scotland, Wales and Ireland, who I meet with regularly, you know, how they're assessing and evaluating. So it will still be, no matter what the wording, it will still be aspirational. And that's the way we believe it should be. You know, as Edith says, you want your loved one or yourself, if you're receiving that service, to get the highest quality care.
Do you feel as if there's been any barriers in the way to achieving? Is there anything that you've identified that's making it difficult for the Care Inspectorate to achieve that aspirational vision?
I think one of the things we've touched on, but I would want to kind of emphasise, is the context within which the services out there are working just now. So we know that there's a recruitment and retention difficulty with staffing. We quite often engage with stakeholders and our provider groups through what we call quality conversations and normal, you know, quarterly meetings. That's something that's coming out strong as a particularly challenging issue, which you'll not be surprised about. I think that appears in other sectors of the workforce and employment. But we know that the ability to retain and have consistent staffing will inevitably sometimes have an impact on the quality of care. I mean, I always imagine if you're a manager and you've got a high turnover, so you might have all your places, you know, your posts filled, but you've got a high turnover of staff, which I think we have seen, then that ability to keep that staff cohesive, clear about what they're doing, understanding the role, is much more challenging. So as Kevin said much earlier, we appreciate the context, and we're trying to encourage our inspectors to illustrate that context, but not deviate away from an outcome focus to that inspection. So that would be one of the things. And I think what we know from our inspections is that what makes a good service is really good quality leadership and management. So there's another kind of key aspect to it.
I think that's quite helpful for us to understand on the committee. If we can think about the last corporate plan up till now, what improvements do you feel in social care that you've been part of and you've been helping to drive forward? Is there any that you can identify?
On the spot, I'm struggling, but and I think what I think has improved is that ability, the development over that corporate plan of more quality and frameworks has allowed us to share that responsibility. As I've said, we still validate those any self-evaluation, but I think the quality frameworks have really helped services understand what we're looking for. What does good care look like? What does it feel like? And where improvements. I mean, I don't think any service would say that they have no improvements to make, and that includes ourselves. But I think that's probably been the biggest bit. Edith?
Yeah, that's okay, convener. So I've already described a bit of the work we've done around Anne's Law, which I think has made a huge difference in terms of services understanding how they can support people to have that meaningful connection. We've done a lot of work focusing around medicines management. We've done a lot of work in supporting services around their self-evaluation process as well. So we've actually, colleagues from improvement and from inspection have worked together and run webinars for services to help them to really do robust self-evaluations, and we've had really good feedback around that. I suppose one of the other things that we do is we have resources available for the sector around a whole host of different things, whether it's guidance, whether it's I suppose, understanding some of the national policy aspects, helping the sector to understand that. So, and that sits on our website so that people have access to that. And actually, we're redeveloping our website at the moment, and that's really important because services need to be able to access that information really quickly when they need it, particularly if we've identified areas for improvement. So I would also say that that's something that's really important that we do, where we work with the sector to develop some of these resources as well. So understanding what their needs are and being able to then support them in different ways. We've seen really good impact of our interventions around that.
Okay, and just to explore a little bit further in terms of how, as an organisation, you would be able to track, monitor and evaluate that quality improvement. So we've heard about some of the tools that you would already use, perhaps in terms of, you know, looking at complaints themselves as being a tool, looking at the self-evaluation forms as being a tool. What other tools do you have to actually track, monitor and evaluate this improvement?
So you just mentioned the Care Home Improvement Programme, which is obviously very targeted, but what we do obviously at the end of that is we do an evaluation of how well participants have contributed and what they've, you know, I go along to the sort of ceremony, award ceremony at the end, and they tell us about that, and it's really quite outstanding. But what we also do then is we look at what are the outcomes for inspection after that improvement work. So are they, and I think I don't remember the percentage, but Edith can add.
So 86% in the first cohort showed an improvement in at least one of the key questions, asked at inspection, and 57% had an improved outcome overall in terms of their grade. So we're doing the improvement work. So we're doing the inspection, we're grading, we're then focusing our improvement work on these services with, grades of adequate. We do our intervention in terms of quality improvement, and that'll be a mix of sessions with all the care services together so they can share good practice and share their challenges as well as having an improvement advisor dedicated to a service. So we do that as well. And then at the end, we measure the impact. So we hear from them, as Jackie has said, in terms of a survey, but we also then have our colleagues in inspection, not right away, but when their inspection comes around, measure the impact in terms of the outcomes from that improvement. And it's been quite significant, the difference that's been made. So we feel that's a really positive piece of work and support to the sector.
Yep.
Yes, I was going to add. So I think it's really important as well that we share the results of that with the wider sector. So it encourages more people to say, oh, there's something to be gained for us in here, and they'll step forward for that improvement work much quicker or much more enthusiastically. So it's really important. We've done a lot of sharing of that information with wider provider sector meetings, and as we just said, webinars and our quality conversations with the sector, so they know what's available, what other people have tried, that it's tested, that it has worked. And that, hopefully for us, means that they'll continue to come and take up the offers that we put out.
Okay, thank you. And finally, from myself, it's come to our attention looking at it that the Care Inspectorate doesn't seem to be represented on the interim National Care Service Advisory Board. So I'm wondering what involvement, if any, that you have had with the board or will have with the board going forward.
So I think I can speak very much about the involvement we've had so far. So one of the examples in terms of the care reform aspects is about our complaints process. We wouldn't want to lose that. We are mandated to do that through legislation. So we have met with government colleagues to say, well, how would that fit with any complaints process that comes through the National Advisory Board? And similarly with quality improvement, how do we do that more cohesively and effectively across the country with all the other providers who also provide different types of improvement, and what are the gaps, etc. In terms of the Advisory Board, I think I can appreciate that that's a decision for the government and not one for me to have a view on. But I think, we have been involved, and we will be. I'll be keen to see, for example, how we play into providing, as we do already, that vision of what's the quality out there, what are the issues, the questions, the very good questions that you and your colleagues have asked. So how do we continue to convey that? And I think that would be up through to the board. Thank you.
Thank you.
Brian Whittle.
Thank you, Convener. We live in a world these days of AI and tech and digital, and I think that the health and social care in Scotland are waking up finally, I think, to the potential impact and the huge impact that this new technology can have on the way we deliver services. Can I ask how Care Inspectorate are developing their own sort of digital and technology offer in this area?
That question. So you'll have heard in our submission that we were very pleased to be funded to take forward a new platform, a new IT platform for our service. We've got a history of having very outdated legacy and not a joined up system. So we've got apps and different bits that don't necessarily speak to each other. And they're at risk, actually, because if they fall down, then we lose all our tools and our information. So we've done a huge piece of work on cyber prevention, etc. In terms of our digital platform, we've got a really good governance around that. So we have one of our board members that chairs the meeting called the Digital Approval Group. We've also got a project group. We've had gateway, Scottish Government gateway assessments, just to make sure that we are progressing this, because as you know, it doesn't come in overnight. But we are already, we presented an AI paper to our board and to partners that sit around the project board. And I suppose our approach to this is that we need to be progressive, and it needs to be a platform that's fit for the future. So we are keen to explore AI opportunities within that. But on the other side, we also need to be very robust about what those AI functionality is that we bring in. So we see huge benefit. I mean, we've talked a lot today about data and how do we learn from complaints, etc., notifications, where the risks are. The big advantage of our digital platform coming in is that it means for an inspector they will see everything on one page about that care service. At the moment, they're having to go look for it, and it's very manual and it's very time consuming. But it's also, you know, you might miss something. The other benefit of it as well, and AI will help here hopefully, is the access that providers have to that platform and through our website to the information that they need to submit to us, so that should be smoother. And also for families, etc., and relatives, that they would be able to see that. But AI is in the early, I think we felt that it's in the early stages, but we didn't want to step on that bus because otherwise we'll lose some opportunities. And we'll obviously look very much for the expertise out there in terms of how we develop that.
Okay, well, one of the things, or one of the main reasons why you know, the implementation of AI stalls is around how you cascade that, how you encourage adoption within both your own people and the services. So how are you making sure that that's in place and that adoption is as maximum as it can be?
Produced a fairly in-depth document in relation to AI and its potential, but early on in this process, last year, and importantly shared that with our board, because they need to be confident that we're going down the right track with that, and obviously the project board. And I think from then I would say we're taking it easy so that people understand the potential, but also understand that there will be a robust protection around that, so that we don't, you know, make the. I mean, we also, in terms of our cyber work, you know, we've identified, for example, people may be adopting apps that are not secure. So we do a lot of review of that, so that we're not leaving ourselves at risk. But I think people will, you know, the whole thing actually, not just AI, but bringing in a new digital platform can be quite unsettling for the workforce, because it's a different way of doing things. So it will be encompassed with that. We've also done a survey of, I can't remember what we call it now, but basically how adept or what's the digital assessment of our workforce. We've got, you know, so that they're ready for. We know what we need to put in place for training development before we launch a new platform.
I was just going to ask that, because when you put forward, obviously, your ask for funding for a new digital platform, which is good to hear. Yeah. You almost need about the same amount again, really, to do that the sort of cascading and adoption and the training of the workforce. Was that part of the business
case? And I think another thing to say, importantly, that came out very positively in our business gateway assessment was that we are using our staff and our workforce, the people who do the job every day, to inform what it is they need. And so it's very much, and that's obviously taking time, but it's a balance between just delivering something that you say, well, you have to use that, and them actually informing it. The other bit that we've built in at the end of once the platform is ready to go live, there's a 6-month period that we will still have support from the provider to work out any fixes. So if things don't go well or there are things that need to be adjusted, we've got that 6-month gap at the end, which I think is really important. But yes, most of those costs were built into the bid.
Can I ask how you will then evaluate the impact of that technology going forward?
Well, firstly, the technology going forward will allow us to produce more effective or efficient data, not manualised. So we will need to look at how much time we're able to take off those kind of aspects. I mean, we're often asked for data from MSPs, from government sponsor, provider bodies, and so that will become much slicker. I think for inspectors, we'll probably do an evaluation with them in terms of how different has it been for them and how much time is it taking off. And it'll also allow us to do much more thorough, in-depth look at how long are our inspections taking, what different aspects, how much time are we spending on different aspects of the inspection, because that should all be within the platform.
I think finally on this, in this particular topic, is around interoperability and compatibility with other services. I think that as we go forward and develop the platforms and tech, one of the key elements of that will be how health and social care is that interoperability across all platforms. How are you making sure that's happening?
So that was part of not just the bid in terms of making the case, but when we've appointed the provider, that's been a clear remit and request that it needs to be flexible enough to then do that in the future, because that bit about looking around the corner, isn't it, and being fit for the future. So that will be, and they're not without, obviously it won't be automatic, but that would be available.
Sandesh Gokhani.
Thank you. And declaration of interest for practicing NHS GP. Kevin, you wrote in 2022 highlighting the need for clear governance and accountability in social care. And Jackie, in May 2025, you noted that the statutory framework is dispersed across various pieces of legislation, making governance arrangements complex. So would the Care Reform Bill that's before us today have been a great opportunity to bring all these frameworks together and simplify guidance for you?
I think the Reform Bill will give us great opportunities in relation to Anne's Law being in there and that visiting, etc. But, and we look forward to working in that. I think our position would be that we'll provide that assurance and oversight based on outcomes, no matter what the structure is. We're flexible to that. So our main aims will continue to be the focus on outcomes for people realising their rights. And we'll do that regardless of the structure or we've already got that legislation in place for ourselves through the Public Sector Reform Bill of Act of 2010 and the Public Bodies Joint Working Act of 2014. Do you want to enhance? Okay.
It just surprised you said it was complex and difficult for you, and yet you say now that it's all fine. That was just a surprise.
I'm not sure what you're referring to, so I can't see the script in front of you, but in terms of what I said and in what context, so it would probably be helpful to share that, and okay. I'm happy to come back to you on that.
Okay, well, that's fine. Would the Care Inspectorate benefit from any additional powers or authority?
I think it's already been considered that we might have additional powers in terms of going to. So, for example, at the moment, we would need to issue an inspection, what do we call it, an improvement notice of improvement before we then move into enforcement through the Sheriff Court. So the potential is that we would be able to go straight to enforcement without that improvement. We would still have a right of appeal, however, I would say, for those providers that would be happening to. Our enforcements have gone up slightly, but they're not as significant, I think, as people out there think that they would be. Because, as we say, because of that improvement angle and that need to sustain services, we're very conscious about communities out there needing services and that demand rising in some respects and getting more complex. So we always go in with that improvement angle to see, can we help this service provider improve what they're doing in order to keep them relevant and sustained, rather than going very quickly for enforcement. However, obviously, there are circumstances where we see risk to life, high risk to life or impact on services that we would go to enforcement.
No, absolutely, and we expect a stepwise process. Yeah. But I suppose the question was, you said that there is some powers that you'd like to have. In particular, looking at the bill that's before us, there is an amendment to try to get you more powers. Do you feel that would be helpful for you, or do you think that that would be a hindrance to you?
Thanks. Yeah, I mean, from my recollection of what's in the bill will be helpful. One of the most frustrating things we've experienced in the past, and I must stress first of all that enforcement is a last resort. We only proceed because we would much rather support the service to improve, because clearly in the case of a care home for elderly people, the nearest alternative might be many, many miles away or off an island. So with that caveat, it was nevertheless frustrating because the bar for us to close a service is very high, serious risk to life. It's a very high bar. And even when we have absolutely clear and strong evidence that that has been reached, it can sometimes take a long time. The biggest frustration is around the improvement notices. Where we serve an improvement notice, we have to, through the legislation, allow a service sufficient time to make that improvement. The time we allow has to be relative to the task that we set them. And if, as they often do, they meet that improvement notice, the improvement notice is discharged. But often what we see is, after a little while, the standard starts to slip again, and we're back into that cycle of up and down. And the frustrating thing is that for the purposes of court procedures, we cannot cite the evidence of the previous improvement notice. Therefore, our view is that it would be better to have sustained improvement as an element, so that if, for example, we have a service who improve, then they go downhill again, they make an improvement because they've got an improvement notice, they go downhill again, we can act more quickly. And I believe that the amendment to the legislation allows us to move to a cancellation immediately without an improvement notice would achieve that. But it is something we would use very sparingly and as a last resort. But it would, I think, from my understanding of the bill, allow us to take action quicker in those very frustrating circumstances when actually it's people you're dealing with. And really, you're in the territory of really, really poor, seriously poor care. We need to be able to act in the way that we would all want to act if it was our loved ones. We only want for others what we would want for ourselves or our loved ones. So we would welcome what's proposed if that's the means of achieving that. But I would stress it's a last resort and would be used sparingly. But if we've reached a bar for serious risk to life, I would have no hesitation in using it.
Okay. I want to unfortunately turn the clock back to COVID-19 and discuss any lessons that were learnt by yourselves, especially around inspections and communication when it comes to the response to potential another pandemic, which we hear is between 5 and 25% likely in the next 5 years.
Gosh, there's so much learning from the pandemic. I suppose one of the things for me was the balance that has to be struck, a very difficult balance when you're considering risk, particularly in a care home for older people, that the risk has to be balanced against rights. And of course, quite rightly, our health and social care standards are underpinned by human rights. And our understanding is that there are plans to make that even stronger in terms of a rights-based approach. But there is a tension there because a care home is not a clinical environment, it's a home. So that risk, I think, one of the things we learned has to be balanced, the rights of the individual versus the rights of the community within that home, the risk versus the right to live a good life, even in a pandemic. And visiting was very much a feature of that. You know, and there are some real challenges there. You know, we saw infection prevention control being a key element of the pandemic. I think services ourselves, through working with directors of public health, we hadn't previously worked with that particular agency in the way that we have worked with them during the pandemic and subsequent to it. Directors of Public Health was a new partnership. We developed new partnerships and very valuable partnerships with a range of organisations, health and social care partnerships. Again, because of the business, the new model that we took, we were meeting regularly during the pandemic with health and social care partnerships, exchanging much more meaningful intelligence. We were giving them immediate outcomes from our inspections, which enabled them to provide support that might not otherwise have been provided. And in return, we were getting concerns past us much more quickly, when they were actually seeing things through normal visits to services. And that is something we've retained, because that's about good partnership working, good information sharing, and we talked about systems and the need for those systems to speak to each other. But there were lots of things we learned for ourselves in terms of how we record information. We hope that the systems we will get through the digital transformation, we've shown and we've known for a long time that having the data, having the intelligence to make good assessments of risks, to deploy inspectors and improvement support at the right time in the right circumstances and in the right place to hopefully prevent a service requiring that really strongest of enforcement action, it requires us to have those systems. So again, we've taken on board a lot of learning for ourselves in terms of our own, how we maintained policy files during the pandemic. We had the chronologies that we maintained. Those have been absolutely crucial. I've recently facilitated 2 days for all our managers to reflect on learning for ourselves. There's learning for the sector. And again, we continue to reflect because we don't want to close our eyes to any opportunities to improve ourselves or indeed for services to improve. So we've really worked hard to supply using our evidence, because evidence is not about my view or Jackie's, it's about the evidence we gathered during the pandemic, and we're feeding that in very comprehensively to both the UK and the Scottish COVID inquiries. I know the statement we've done most recently run to 200+ pages and 4 lever arch files of documents, but we're keen to support that learning, so we've not closed our minds to what may come out of that inquiry, and whether that's learning for ourselves or learning for the sector, we have to be a learning organisation. I think we are a learning organisation, and if it's deemed we could have done things better, then we'll learn from that. But equally, I think there are things there that we've done. A flexible response team that we did during the pandemic was really successful in sharing and helping services to interpret guidance that changed almost on a daily basis. So there's lots there. I could speak for hours, but I'm sure you wouldn't want me to do that at this particular juncture. But yes, we are very much taking on board the learning, and not even at this stage, 5 years down the line, we're still waiting to see, to support, what to give to the inquiries, what we know, but also to receive, ultimately I suspect all of us, to receive what recommendations arise from the inquiry to hopefully deal with anything of that nature or a similar nature better. There's always room for improvement.
I mean, certainly we're not the COVID inquiry, so we don't need to go into quite that level of detail. But my final question is around ANSLAW and its introduction or potential introduction later on today. Will that introduction change the balance for you to really allow people to have that family life?
Edith is probably more aligned to this, but just from my experience during the pandemic, I think there is absolutely no doubt that we've strengthened the approach even prior to this legislation, and we've put a lot of effort in working with services to help them understand what's required. I think what was quite helpful was the inclusion of 2 new standards in the health and social care standards that made it very clear. I suppose you could term that as an interim arrangement, but I think the opportunity now there is to strengthen that in legislation so that in future people are not deprived of their right to connections with loved ones. There will still be responsibilities, I suspect, on directors of public health, who are the experts in infection prevention control, and will undoubtedly now and in the future have a view on what should happen. But the legislation, I think, will give everybody a greater understanding of the balance, a better balance that needs to be made about risk. And I suppose that was what I was alluding to, the balance between risk and rights, and having to get a more alignment. And from my understanding of the legislation, this will help support it.
Maybe if I could add to that, Convener, if that's all right to do so. I think we're very supportive of ANSLAW, and we do hope that ANSLAW would enable a more consistent approach in terms of when we are out on inspection, we would always look at well-being and the elements of Anne's Law would be within that, so around visiting and meaningful connection. And if we make requirements around that, if a service is not adhering to that standard, if you like, then we would hope that Anne's Law would support that process and help to ensure that services would then, if you like, step up to the mark and support that visiting. We have developed a self-evaluation tool actually around visiting as well that we ask services to complete, and as I say, we do look at that element every time we're out on an inspection as part of our core assurances that we use. So we welcome Anne's Law, and we do hope that it will provide that extra support in terms of enabling people to live a good life no matter their situation.
Thank you very much.
Can I thank the panel for their attendance today and their evidence? My apologies to colleagues who wanted to come in further to that. We'll briefly suspend to change panels. Thanks. Welcome back to the Health, Social Care and Sport Committee. The next item on our agenda is an evidence session with representatives of Food Standards Scotland. And I welcome to the committee Heather Kelman, Chair, Ian McWatt, Deputy Chief Executive, and Gillian Purdon, Head of Healthy Diet and Nutrition, all from Food Standards Scotland. And we'll move straight to questions, and Sandesh Gohani.
Thank you. Declaration of Interest, a practicing NHS GP. Morning, panel. I'm really concerned about biosecurity of our food, with only 5% of live animal imports subject to check, with the target being 100%. DEFRA and the Animal and Plant Health Agency are ill-equipped to handle high-impact diseases such as foot and mouth and African swine fever. So what tools does Food Standards Scotland have to try to improve our biosecurity? And do you agree that food biosecurity matters?
Thank you very much for that question. I'm going to ask Ian to come in a little minute, but if I could just assure you that we take biosecurity incredibly seriously and work very closely with our Chief Vet and others in this front. I participated in a Four Nations meeting with the Minister, Jim Fairley, yesterday, looking at the issue of the border controls on the West Coast. And we're offering to do some intelligence-led gathering on the risks to try and get some evidence on the actual quantity of risk that's there, not just the theory of risk. So we're looking to do some additional work on that this year. But for more information, I'll pass you over to Ian, because he heads our Ops Division.
Thank you. Could I take your last question first? Does it matter? Absolutely. Food Standards Scotland is what we call the central competent authority for food in Scotland. We are the largest employer of official veterinarians, and we deploy all of these staff into our approved slaughterhouses. Since EU exit, we have repeatedly flagged concerns in relation to the number of qualified veterinary personnel that we have available, who ultimately would carry out a lot of these checks, in addition to food enforcement personnel in local government. We have changed our model in the last few years to have a fully employed veterinary delivery model, which gives us better control over the recruitment, the competency, the training of these personnel. But it is an absolute fact that Food Standards Scotland, in the recruitment of our vets, that we have only 2 UK veterinary official veterinarians in our employ. The vast majority come from the EU, and we continue to, thankfully, due to the employed model compared to the contracted model elsewhere in the UK, continue to attract staff. So in one sense, we have mitigated some of the elements of the biosecurity controls that are required. But when we also consider that a lot of the food law delivery does sit within local government, we are now just about to embark on our SAFER programme that is about the rebuild and reform of the food law delivery landscape in Scotland, because we have, as I said, repeatedly flagged multiple concerns about the fragility of the system, and indeed some elements of the system not functioning particularly well at the moment. So there are risks. We are mitigating them, working with partners across the UK, and we are looking to embark now on a journey of reform over the next 3 to 4 years.
That was about biosecurity, and my final question is about just food security. Given the ever-changing landscape in geopolitics that we see, having secured our own food and resources that we have, both in Scotland and across the wider UK, is very important. Now, I've just finished watching Clarkson's Farm, and that shows me the precarious nature of farmers and farming. So in the past 10 years of Food Standards Scotland, what's happened to our farmers? Do you feel that they're under increasing threat now? And is there anything that you can do to try to protect them?
I think the first point is that farmers are really out with our function. We deal with the food end, but that doesn't prevent us from meeting regularly with the National Farmers Union of Scotland to talk about areas of common interest, one of which is the guaranteed supply of as much fresh and local food as we can in Scotland. We'll be meeting next week, I believe, with some of their policy leads to look at the food chain and the interaction where we have common agenda. But in the main, the actual farmers and the work around that sits with rural agriculture, environment. So I don't know if that's quite the answer you were looking for. Is there anything in specific that you would like me to talk about?
Well, so obviously the food end, but food comes from somewhere, and
Yes.
it comes from farms. And so that's what I was looking at, the entire supply chain.
Yes, and that's really where we're going to be meeting with the head of policy on the supply chain next week. Just it's a new appointment just to talk through that whole thing. We take over at the farm gate, really, on the animal welfare side, and we work very closely with Scottish Government officials on food security, food sustainability. Jeff sits on the food security group committee just to make sure that we've got an input into there. So looking at the quantity and quality of food that's available is really vitally important from a nutritional point of view. Because obviously we want to see as much fruit, vegetables and that, etc., grown in Scotland as can be done. But our role on food production is less in the farming side than it would be in the food manufacturing side. Ian?
If I could just add to that as well, that one thing that we have or has crystallised, particularly since EU exit and COVID, is the complexity of our food supply chain. And I'm sure committee members will be aware that there are a number of incidents running currently at the moment that has really impacted on that supply chain, mainly through the cyber security elements, and there are some challenges being investigated currently. So that is a principal intersect for Food Standards Scotland and Scottish Government colleagues, where a lot of our time and investment is going into engaging with producers, retailers and wholesalers to ensure that there is some sense of priority given to the supply of food and food security in general. The last incident, of course, that is widely publicised, that a lot of the focus has been on ensuring supply to lifeline stores, particularly in areas, remote areas that don't have very much of a choice into where they procure their food supply. So it's an ever-increasing complex landscape.
Just add one final point, is just maybe to highlight the forthcoming Good Food Nation and the opportunities that that will also have in terms of looking at our role in that space and looking at the system, you know, the food system in it as a whole. So I think that there is opportunities for us to be more coordinating in terms of our role in that space.
And just a final point, our food crime unit obviously provide evidence and information for farmers on how to protect crime that might affect the food chain. So we try to give support in that field as well. So around the food crime and the bad players side of it too.
Thank you very much.
Emma Harper.
Thanks. Just a quick question. Good morning to you all. Did Brexit make sanitary and phytosanitary checks more complicated and basically worse for food exporters from this country?
Ian, I'll let you take that one. You're the expert.
It's a really good question. So Heather's just mentioned our food crime unit, and we have not got any direct evidence that says that things are deliberately worse from a food fraud perspective. But what has absolutely been challenged is the number of people, qualified, competent, skilled people available to undertake the checks that are absolutely required. There's also a bit of a moving feast insofar as the deadlines for certain border controls coming in place. These were continually being shifted, and of course the introduction of certification requirements in particular, that there was little time to prepare for that requirement, and of course there was little opportunity to ensure that we had sufficient people on the ground that could actually certify and do the checks that were required. So looking at it through that lens, I would say that you could come to the conclusion that there was increased risk. But in terms of that materialising in the incident space, we don't have any clear evidence that that has indeed happened.
Thank you, Convener, and thanks to members of the panel.
Can we have Mr Sweeney's microphone, please?
Thank you. Thank you, Convener, and thanks to members of the panel. I just wanted to ask if you could reflect on where you would like to see Food Standards Scotland in 2035, when it will be celebrating its 20th anniversary.
I would like to see us, I feel we've had a very good first 10 years, and I believe as an organisation we've now matured quite well, and we're doing our next strategy in phase that's going to look at, we're really trying to benchmark ourselves against world standards now and looking at where we could improve our performance against the WHO standards on good food safety measures. So we're doing a lot of work at looking internationally to get a benchmark as to where we could improve. I think we really want to be looking more at a digital evidence, information, intelligence-based system of food law enforcement, and to really be world leading in having that really efficient system that enables and supports businesses to provide safe, nutritional, healthy food. I think all of us here would love to see food and dietary health prevention be far more in the front line of how we feed our nation, that we actually have a very strong food environment that is ensuring that everybody, regardless of their income or their background, is able to access affordable food. And that means looking very closely at the food environment that we operate in within Scotland. So improvements on food, access to healthy, nutritious food, improvements in digitalisation and enabling businesses to work proficiently and efficiently at good quality, high food and safety standards, and ensuring that we have a strong evidence base. Sadly, with some of our budget restrictions, we've had to reduce the amount of research that we've been doing, and there are some areas we would like to build that back up in, so that would be another wish for the board, is that we are able to rebuild our gathering and production of evidence and reports for government.
Any other thoughts that anyone has?
We're straying into the questions that Mr Torrance is about to ask.
Okay. Apologies.
David Torrance.
Thank you. Good morning to witnesses. What assessment would the witnesses make of the performance of Food Standards Scotland to date in relation to each of the 5 priority outcomes set in 2021-26 strategy?
It's been a difficult few years. I'll be the first to admit that, in that we had both Brexit and COVID during that 5-year period. And we have tried to stay very focused on our main function. When we've done any prioritisation review of what we're able to achieve, we have gone back to our original functions as a regulator, as a public health body, as a representative of consumer interest. And I believe that we've done very well in most of those. I think if we look at certain examples, I think our food crime unit is really coming into being an internationally recognised expert in the area of food crime and intelligence gathering on food crime. We've now got our SAFER programme, which we're about to launch, which will look at digitalisation, evidence-based, really modernising, looking at the future for how we have a high-quality standards protecting the public system that enables local authorities to have less person inspections, but more intelligence on which to base their visits and enforce food law. So we've done a lot of preparation work on that. Gillian, would you like to talk about some of the achievements on the nutrition side?
Yep, happy to do that. I think one of the key things for us is our surveillance capability has improved significantly over that time. So a couple of examples of how we've managed to achieve that. for a long time we supported the, digital tools to collect dietary information, and we now have Intake 24 integrated within the Health Survey, which is unique in the UK, to use that tool to also be able to look at diet and link up with health outcomes as well that are collected as part of that survey. It's the same tool that's used in the National Diet and Nutrition Survey, so it allows us to compare across the nations as well. So that's unique. We have commissioned our own bespoke surveys where we've had data evidence gaps, like a survey of children's diets. That we're over 10 years before we'd had a dietary survey of children, so we've got evidence there, and we can assess the nutrition across the organisation. And we've also developed consumer-facing tools, so to support the Eat Well guide, which demonstrates or shows what a healthy diet looks like, but to actually help consumers make changes to their lifestyle and their diets. We've got a tool called Eat Well Your Way. It's available on our website, and that's one of the other key things. I think we've also got tools for teachers and teaching resources. That's available on our website as well. So we do link up there, and I think all of these things have developed over the past 10 years and create many different ways in which we can help the population have a healthier diet. Yeah.
And just in terms of that commentary, in terms of how well you think we have done, with the resource that we have been provided, we're absolutely punching above our weight. We're a small organisation that is now recognised internationally, and we have a lot of attention. A lot of visitors come here to see how we do things. I would think that we could certainly do better. We're one of the few organisations that, since we were vested in 2015, have had a flatline budget, which is in excess of 20% real terms cut. So you no longer will see Food Standards Scotland actively campaigning in the ways that you would be used to, and there are plenty of messages out there that we would really like to amplify. But until such times that our budget will allow, then we'll need to seek new and novel ways that don't cost any money, using social media and such like. But there's definitely a sense of punching above our weight. You only need to look at things recently publicised, such as the tea crime case, tea fraud case in Scotland that has secured a successful conviction. And we've got a small team of 4 investigators that every stone they turn over, they find something. But we're now having to actively throttle back, for example, because we don't have the resource to turn over the stones we think could be turned over.
Looking to the future around the 2026-31 strategy, how will that change, and what consultation will take place with stakeholders to make these changes?
That's a very timely question. We're going to be discussing this at our board next week. And at the moment, in August to September, will be the public consultation spell of our new strategy. So, as I said earlier, we're basing this on Jeff, and the Chief Executive and myself did an assessment against the WHO document on global strategy for food safety 2022 to 2030. And we've identified the areas that we feel we've got to improve in. And I've got some of these noted in front of me. So we've been looking very closely at consumer protection again, and upping our science and evidence base, evolving and reforming the regulatory landscape, providing an effective public service for the people of Scotland, ensuring that we deliver effective, efficient, inclusive and involved, consulted on services. We're also have a section this time we're going to be including specifically more on sustainability and climate change, so that we have more of a strategic commitment to the requirements to improve the sustainable environment. So we've got, and if anybody was interested, I'm happy to share that analysis of where we are comparing ourselves worldwide. So we're going to be the public consultation, as I say, is going to be done from the 1st of August till the 12th of September. Stakeholders will be emailed with a link to complete the consultation, with a reminder sent halfway through the consultation period. We'll be sharing it directly with local authorities through our monthly enforcement report to allow the authorities to comment. We will be putting a live link to the consultation on social media. where we have regular stakeholder meetings, which we do a lot of with Food and Drink Federation Scotland, Scotland's Food and Drink, other bodies that involve QMS. We will be advising them that the strategy is live and invite them to comment. We'll be sharing the consultation with MSPs and Scottish MPs at Westminster, and throughout the period that the consultation is live, we will monitor the completion rate as well as the type of organisations completing it, and we'll target areas that we feel are underrepresented in that consultation process so that we can have confidence in the robustness of our consultation period.
Thank you. I have no further questions, Convener.
Patrick Harvey.
Thanks very much, and good morning to the witnesses. Heather Kelman was just talking about the issues that will be in the consultation in the development of the new strategy, and I was very pleased to hear the commitment that there'll be greater emphasis on climate and sustainability. These were mentioned a bit in the previous strategy, but I don't think at a terribly specific level. My question really is about how much autonomy Food Standards Scotland has to set a direction of travel on this. You'll be aware that the Climate Change Committee, the independent advisory body to both governments on climate, has recently set out its advice about how to meet carbon budgets for the rest of the journey to net zero. And that has specific conclusions for agriculture, for food production. There's clearly got to be a link between food production and the consumption of food. There's a huge overlap between more sustainable food and healthier food. And yet we know that this is already getting some reactionary pushback. The Scottish Government's climate plan is not going to be produced in time for you to consult on your strategy for 26 to 31. The scrutiny in Parliament of the draft climate plan is likely to run right up till the end of this parliamentary session and may even not be completed until the new Parliament sits after next year's election. So how do you intend to give effect to the very clear conclusions of what's in the CCC report about food in the absence of a Scottish Government climate change plan having been published and adopted?
Thank you. That's a really good question. I think, first of all, the work that the board have looked at is that there's very little impact we can have internally within FSS. We're a very small organisation and have a proportionately small carbon footprint, but the whole environment of food production, food environment, is obviously something that we can influence rather than direct. So our role is to advise Scottish ministers regarding policy to improve diet and health. And although our competence lies within Scotland, we do also take that beyond to the UK Government and make sure that our interests are represented at UK-wide. I'll ask Gillian in a minute just to comment on some of the work that we've looked at in terms to the advice we've given to the Climate Change Committee and the research that we've done that looks into some of the recommendations and the impact that might have on population health, because there's a direct correlation between some of the recommendations and the state of our nation's health, and that obviously has to be one of our priorities, is to protect the public health. Evidence has shown that reliance on voluntary approaches is insufficient to address the scale of the challenge, calling for more debate on appropriate mandatory actions being necessary, and we will continue to make some of that call. We have recommended that the UK Government prioritise several actions within their reserved competence that might help us with further fiscal measures. We know that following the Eat Well Guide would have a significant reduction on the carbon footprint associated with diet and health in this country. And to achieve that, we need support from the UK Government on things such as advertising, market restrictions on high-fat salt sugar, mandatory reporting on food and drink sales data so that we can look at where the areas to improve would be. If we knew what was being sold, we could influence it, and further fiscal measures such as the sugar tax, etc., but going into other areas where we would want to see improvement in terms of achieving that Eat Well Guide, because that's, if we know that it can contribute to a significant reduction in the emissions that are associated with what we eat in this country, that would seem to us to be a really good place to start on the dietary, rather than looking to change the dietary advice, which might then affect the health of the population. But I'll pass to Gillian for more of the detail on that.
Yep. Thanks for the question. I think there's just a couple of points to highlight. One, we're currently undergoing a review of the Scottish Dietary Goals, and part of that review is looking at the data supporting health improvement, and the goals are set with that predominantly in mind, but also with sustainability too. So the results of that review will be published towards the end of this year. So that's one way in which we're addressing these issues. We've also done work looking at adherence to the Climate Change Committee recommendations of the Scottish population. So we've done an analysis in adults looking at dietary intakes, but we've recently also done one in children, and we're putting that advice up to the Minister very soon. But in terms of looking at adults, if we were to adhere to existing regulations, recommendations, for red and red processed meat, for example, and for high consumers to reduce to recommended maximums, then that would actually achieve a 16% reduction in meat, and would go a long way to achieving some of those recommendations, or certainly the first stage of them. But we need to be really careful, I think. And an analysis has shown that if we, as a population, currently our diet is really poor, so only approximately 1% of the population, even less, meet those Eat Well Guide recommendations or the Dietary Goal recommendations. So if we are to start to change things and reduce meat, for example, then that can have a negative impact in terms of micronutrient status. And it is possible to reduce meat with good replacements and still have a healthy diet. But because our diets are so poor, there is a risk in doing so. So we really need to look at the totality of diet and really improve it and move to achieving more of those goals and recommendations. Yeah. Sorry, do you want to come back?
I appreciate that. Yeah. But in short, the consultation on the 26 to 31 strategy will consider how to implement the recommendations from the CCC.
Heather, it'll certainly be part of the
considerations. It will be part of the considerations. Yeah. I think we've got a little bit more evidence to gather on. So we know that the recommendations on red meat could be implemented and retain nutritional competence, but the problem with that is it would require quite a more complex menu planning and eating pattern for our population, and may affect people's ability to afford to eat a healthy diet. So we need to understand that better before we would be saying, because we would not be compromising public health over emissions. We're hoping there is, by following the Eat Well Guide as a whole, there is a compromise where we can reduce emissions that are associated perhaps with more discretionary foods and products, the high fat, salt, sugar diet. If we could reduce our commitment as a nation to eating discretionary foods, we would be able to reduce the carbon emissions associated with food production in Scotland and food consumption in Scotland. So it's a difficult balance, and we're totally on board. We all are absolutely committed to looking at sustainability, but we have this difficult situation with the evidence saying that there may be adverse dietary implications for our population, particularly our children and young people, which would not be good for the economy in Scotland or for public health. So we also need to balance that up with where does dietary advice have real traction to gain that improvements in carbon emissions, but without affecting people's health and well-being. And that was included in our evidence to the Climate Change Committee that we submitted a year ago.
Yeah. I think just one other thing just to probably highlight is that the Climate Change Committee recommendations are for reduction in meat and dairy has a lot of protective elements to it. So we have to be careful in terms of what we can, in terms from a dietary perspective, agree to, and what should be more cautious. So I think that's why government have partially accepted those Climate Change Committee recommendations. But it is for government to really do the risk management and link in terms of actions to support that. And they go right across the food chain, the food system that needs to be looked at. So it's quite challenging and difficult. And we found that even with the review and the dietary goals, the number of different parts of government that we need to liaise with as part of that process means that it can be quite complicated, but not one that we should obviously shy away from. But it's just that there is a lot of complexities and different things to balance whilst doing so.
I can feel the convener's impatience with me, even through the internet. So I'll resist the temptation of carrying on with this. But I think there's there's clearly more consideration of this needed in future.
Thank you, Mr Harvey. Brian Whittle.
Thank you. I'll continue if you like, Mr Harvey. Just a very quick one off the question from Patrick Harvey, just to you, Gillian. And one of the things you've kind of highlighted a concern of mine in terms of this blanket, we eat too much red meat. Concern for me is those who don't eat enough red meat. If we continue this message, they may even reduce their meat intake even further. So we agree that if you eat too much red meat, it's bad for you. But there's also the other side of this. If you don't eat enough, that is equally as bad for you.
I think what I would say is that you can have a healthy diet with no meat in it at all. But because we don't, as a population, have that diet, it means that there's more people at risk if they were to reduce meat from current levels, shall we say. But as you say, there are a lot of people who are eating too much meat, and they would be better for their health in terms of colorectal cancer risk to reduce that amount of meat. So what you say is kind of correct, but but we can actually have a healthy diet with no meat in it at all, but we currently don't. I think in terms of the overall trends in terms of meat consumption, we have seen a decline over time, and it seems to be reducing. Now, the reason for that we're not sure of, but it seems to be more cost-related than it is necessarily health or message-related. So we're not entirely sure why that trend is going in that direction, but that does seem to be the direction of travel. So we will have to keep monitoring this. It's something that we are very alive to, and I think when we look at the children's diets, it becomes even more highlighted in terms of certainly the contribution of dairy, particularly because almost all children have some dairy, and then meat. If they are to reduce, then obviously the impacts of that are even more accentuated. So yeah, it's really important that we continue to look at this and monitor.
I think where I was going to start was the reality of Scotland is we head the charts in too many of the bad areas. We are unhealthiest nation in Europe. We're the most obese nation in Europe. We have so many poor health indicators, and a lot of that, obviously, nutrition is a big part of that. So can I mean, one of the things that really, we talk about food security, but there's also the nutrition security as well. What role does FSS have in terms of looking at that in our public services like schools and hospitals? I think that there's too if we talk about climate change, there's too much of food from schools and hospitals is imported, and too much of it is made elsewhere and shipped in. So what part does Food Standards Scotland have in monitoring the level, not just the levels of food security in terms of those, but in terms of nutrition within those meals?
Well, I suppose our role sits at that nutrition level point. So in terms of setting the regulations for foods that need to be provided in school, they have to meet specific nutrition requirements. They align with the dietary goals, and that's basically our role in terms of expertise, the technical expertise in setting those amounts. It's up to the local authorities, the schools themselves, to then procure and provide food that meets those recommendations so that supports a healthy diet. Now, so we don't have a lot of information or data on that, I would say, and I think that's maybe where there's good opportunities within the Good Food Nation to really look at that in a bit more detail and actually try to shorten some of those food chains and improve some of those procurement. We have been working closely with government colleagues and Public Health Scotland on an Eating Out, Eating Well framework. So that's going to start off it's predominantly focused on the public sector, but then will be rolled out. But within that, we can look at some of those elements that you talk about, sustainability, but procurement as well, in terms of where food comes from. But at the moment, I think our main role has been in setting those technical specifications rather than being able to answer some of those questions.
Can I ask then, in terms of those specific dietary requirements in the public sector, is that negative stuff like low fat, low sugar, low salt, or are we into what nutrients should be in there, you know, our iodine and magnesium and all that kind of stuff. Do we get into that, or is it negative? Is it?
I wouldn't say it's negative. I think there's recommendations. There's things. It's new. It's been piloted. That's where we are at the moment. There's things like maximum calorie caps to adhere to, so that gives more scope to, as long as you're achieving them. There's things like principles of increasing fibre, for example. So that's a positive nutrient. So it's perhaps more pragmatic. It's designed to be something that can be or applicable across a broader range of different types of businesses. So that's where we are with that at the moment. I think, yes, there will be recommendations for things like low fat, because that helps to reduce calories that are provided. And we know, particularly in some of these out-of-home type things, the portions are large and the calories tend to be much higher than foods that you would typically eat at home. So that's the approach. But it's been piloted and we're yet to be rolling that out. That's the next stage. So we're awaiting government on that.
Would you agree, though, that the sort of schools specifically, but also hospitals, are a good battleground, if you like, for developing a better diet? Yet, if we look at that, more than half of hospital food's thrown out and a high proportion of school food's thrown out and a high proportion of kids don't take do the uptake of free school meals, and so we're failing in that element.
But I think we are going in the right direction. There has to be portions of fruit and veg on offer to children, and I think what we see is when we look at the dietary intakes, particularly in primary school-age children, their diets are actually pretty good. It's actually when they get to that sort of secondary, a bit older, and adolescence, where they have more agency themselves and are able to have basically more influenced by that wider food environment, which then can encourage them and to purchase things that are available, and the things that are available tend to be high fat, salt, sugar, and they're ubiquitous, really. So I think we do see that, and I think that's where we need to try and look at that broader environment. Actually, I think the school setting, we're doing a pretty good job. I'm less close to some of that hospital stuff, although we do have, there is a working group and we do have a member of the team sitting on that to ensure the technical elements are nutritionally correct.
Yeah, we obviously are welcoming the Good Food Nation work, and myself and Dennis Overton have met and are going to meet quarterly going forward to look at where can their role in in making sure that Good Food Nation plans by local authorities and health boards reflect the standards and the guidelines that we're expecting. And I think between us on the sort of technical nutrition side and them on the planning side, we would hope to see some real improvements. On hospitals specifically, I think we have to look at how long patients are in hospital and why they're there. So there's not quite the same opportunity in our acute hospitals to influence people's intake. Staff, yes, and there's a lot of NHS staff, so I think that's still worthwhile doing. But I think in schools, you're absolutely right. We have got to use those opportunities provided by school meals to encourage a broader range of healthy foods to be tried, tested and consumed.
Well, I'm going to say, I think in terms of schools, I think it's very patchy. In terms of hospitals, I think if you produce the food in Wales and then drive it up the M6, I think the likelihood of it being decent food is lower. But my final question is, you know, what is your assessment of the likelihood of the Scottish Government hitting their target of halving childhood obesity by 2030?
I think it's a challenge, and the way that the statistics are looking, whilst there was a bit of a blip around COVID, we've seen the body weights come back down. So that's encouraging. So we're not seeing quite such a trajectory in the wrong direction. But I think it's going to be a very big challenge to reverse that. It can be done. It has been done in some places. The Netherlands have seen good results in that regard. I think that the issue, I think, is that the time frame is relatively short now. So I think these things do tend to take time. So I think it will be a challenge. So we'll have to see. I don't have a crystal ball.
So look at what Japan did.
Yeah, I think Japan, there is good examples, as you say, internationally, but there needs to be quite a lot of intervention, lots and lots of levers all being used at the same time.
There's a definite challenge, and it's only through positive action will we have any impact. It will not happen by default. It's too big a challenge, and it really needs everybody to focus on the food environment that children are exposed to and make change.
I'll leave it there. Thank you.
Thank you. Emma Harper.
Thanks, Convener. Good morning to you all. It won't be a surprise that I'm interested in ultra-high processed foods, and I know there's a difference between processed foods and UHPs. I have been following the work of Henry Dimbleby and Dr. Chris Van Tullochen, Carlos Monteiro in Brazil, and looking at also, Henry Dimbleby spoke at Dynamic Earth last April 2024, which was really interesting. I was a privilege to be in the audience there. So UHP it's created using food tech and food science purely for profit, and there's issues I find in this commerciogenic environment that low-cost ingredients are created from fractioning and then recombining and adding chemicals which are essentially cosmetic to enhance colours and flavours. And I just want to be clear about what it is I'm talking about when we're talking about UHP. So I'd be interested to hear if Food Standards Scotland have a different view now compared to what was outlined in March 2024 on the topic of processed and ultra-processed food, because we are a year on and more research has been done and presented, so I'd be interested to hear about that.
Take that one. Yeah, I think you're absolutely right. We are keeping a watching brief on this evidence base because it is emerging all the time. The SACN, the Scientific Advisory Committee on Nutrition, did publish an updated position statement a few months back now, so we can send that on to you, where they're not recommending a change at this time, but we are very aware that that evidence base could shift, and so therefore we are keeping an eye. I think for us there's a very large crossover between ultra-processed foods and high-fat, salt, sugar foods. We're not entirely sure of the percentage, but it could be in the region of 80 to 90% of ultra-processed are high-fat, salt, sugar. Now, that's where there's a larger body of evidence, and that's where we're continuing to focus our efforts in terms of reducing those high-fat, salt, sugar foods, many of which, as we say, are ultra-processed. I think just one other thing, and I know it's coming up, or it could come up later, in terms of ultra-processed foods, I think food fortification is one example of a means that industry can use to enhance foods, and they would almost always be termed ultra-processed. But if you take, for example, an alternative milk drink, so a plant alternative milk drink, that will be very poor in terms of nutrition composition compared to cow's milk, unless it's fortified. And that's when you put things like iodine, calcium back into those products, because the way they're eaten, they tend to be similar to a cow's milk. So I think not all ultra-processing is bad. That's what I would say. And the other thing about the ultra-processing, and you mentioned some of the aspects of ultra-processing, and we have to say that they are all safe. Anything within these types of products has gone through all the safety checks that needs to be done and meets those regulations. But there is also quite a big disparity in terms of inequalities in terms of ultra-processed foods. If we had a very hard line, for example, on ultra-processed foods, that would mean that potentially those in the more deprived areas would find it more difficult to eat healthily, because things like wholemeal bread bought in a supermarket would be deemed ultra-processed. And we would deem that as a healthy food, and we would, things like tinned baked beans, for example, similarly. So I think there's many areas where we need to be a little bit careful and not just look at the processing, but really the nutrition composition as well.
And I'm not suggesting a reformulation tax or anything like that, because I know the challenges of people in areas of higher SIMD, for example, and we know that kids, or we've heard that kids in the UK are actually smaller in terms of height because of the impact of austerity, 14 years of imposed austerity, poverty, and the challenges with access to healthy, nutritious diets. And I know the difference between fortification, as in vitamin B12, but my concerns are around emulsifiers, stabilisers, colourings, all these additives, all these chemicals like guar gum, xanthan gum, mango oil and, you know, whey powder. Whey was used for fertiliser for fields, and now it's a product that's used to build the protein required in some of the products. So, I mean, what can be done then to help? Is it a matter of educating people? Is it a matter of restricting what's on the end of the aisle or at the front of the checkout? What needs to be done to help support people to make good choices?
One thing that would be really helpful, and I think we have recommended that high-fat, salt, sugar food, the promotions of those types of foods are looked at, and we are awaiting an announcement from government soon in terms of their position in terms of taking legislation forward to look at that. And I think that would go a long way, because as we say, the intersect between ultra-processed and high-fat, salt, sugar is there's quite a lot of the same types of products. So that would help to steer consumers away. I think I would always go back to the Eat Well guide, which shows the balance of foods that we want people to eat, and if people were able to adhere to that, it actually would result in them eating less processed foods, because it's very difficult to meet those recommendations whilst still eating a lot of processed foods, even simply because a lot of them have a lot of salt in them, let alone any of the other things that you're highlighting. So I think there's a lot that we could do just by actually achieving those existing dietary goals. And just on that, in terms of the review of the dietary goals, ultra-processing is one of the considerations that has been taken into the fore. So we're looking at things like discretionary foods, sustainability, which I mentioned, but also ultra-processing to see whether that's something that would be sensible to be included within that dietary goals for Scotland. So we have taken that into consideration during those discussions.
So we'll just continue to watch out for the evidence that's coming out from specialists like Carlos Montieri in Brazil.
Absolutely.
Regarding the ultra-high process, that chemistry that's added to these enteric substances.
Yeah, we certainly have a watching brief on that. We will continue to do so. But the review of the dietary goals, which will be published at the end of the year, will show how we've looked at the evidence base as well, is more specifically in relation to the dietary goals and achieving those too.
Okay, so, thanks. Thank you. Thanks, Karina.
Sandesh Gohani.
Thank you, Karina. Just very briefly, food science. There's a lot of evidence that shows that it's there simply to make us eat more. So let's look at Pringles, that noise that the can makes, the way that food is now a lot softer than it used to be. You get initial crunch and then it disappears. Surely this is something that we need to be tackling.
A very good point. I think a lot of the ultra-processed food is more palatable. You can consume more calories more quickly and therefore take more calories on. But I think it's very difficult to disentangle that between the other characteristics of that food, the fact that it's a high fat, salt, sugar containing food, for example. And so that's where we're not able to show a specific link. So therefore there's no, it's difficult to then change advice on that basis. But you're absolutely right in terms of a lot of the ultra-processed food would be that palatable. And therefore we'll just have to keep an eye on the evidence base. I think we have to be, science has to be really robust for us to change dietary guidelines or dietary recommendations. And the last time we did that was back in 2016, looking at sugar and fibre and upping fibre and reducing sugar in terms of those recommendations, because the evidence base could dictate that. And we look at the consensus evidence, and that's why we go to the Scientific Advisory Committee and their assessment of risk. But we're also keeping a watching brief as more evidence is published, and we will revisit that. But yeah, I think you make a good point.
Elena Bettam.
Thanks, good morning to yourselves. I have two questions. The first is around about food federation plan, and the second is around about the Scottish Food Commission. So I'm wondering to what extent FSS has been involved in the development of the draft National Good Food Plan. And if we think back to the evidence that was provided to the committee in 2024, you did have some concerns round about some of the linkages between the actions and the intended outcomes. So I'm wondering if you've been satisfied that these concerns have been addressed, or if there's still some concerns that remain.
We have actually linked up very closely with the Scottish Government in terms of developing those outcomes and indicators, particularly because you may or may not be aware, but the dietary goals are part of that suite of indicators. So I think it's looking at how that's been developed and baselining the information and then reviewing it. So in terms of the diet side, yes, we've had quite a lot of liaison, and in terms of what will be coming out in the national plan once it's published, I think that has been really tightened up. So there's been a lot of liaison. So yeah, I would be quite reassured that I think that process, they responded to the feedback that came from the consultation, which had some questions around the robustness of those indicators, and I think that we'll see that being addressed when the new plan is published.
All right, so that's really good to hear then, that you feel as if you've been able to feed in the concerns, and that the linkages are actually really robust now in terms of what you're expecting the draft plan to say. Okay, fantastic. And the second question I have is round about the Scottish Food Commission, and there was a little bit of worry between where your role stopped, where their role started, and how that was actually going to be managed. So do you feel as if there's now a clear division there about the responsibilities between yourselves and the Scottish Food Commission?
So far, I've had one direct meeting with Dennis Overton, and we're waiting for the Scottish Food Commissioners to be appointed, and then we hope to have a joint seminar between the Commissioners and our own board, just to make sure there's no misunderstanding. In terms of actions, we've been giving support where we can without it causing us extra resources, because we are working very tightly to what we can deliver. And so we're very positive that the ambition is that we work alongside each other, meet where we need to, but have clear delineation and don't replicate or have gaps. So I'm very positive about how we're going to go forward together.
Okay, and I mean, we've heard several times this morning in terms of the resourcing is very tight. So are you satisfied then that this is not going to add any extra workload onto yourselves in terms of the resourcing that you have? Because as you've described it there, it's working in parallel. Do you think that you're going to be able to work together without that extra pressure?
My hope is that we'll develop a memorandum of understanding that explains what access they can have to the work we're already doing. A lot of our tracking that Gillian's team does on nutritional standards, etc., there's no reason why that can't be shared. It doesn't cost us extra to share it, and they'll have open access to our evidence. If they were requiring us to take on additional work, we would be looking to them to fund it, is the bottom line. The board just do not have any space within the budget to reprioritise work away from what we've done. We've reprioritised what we do, and we've cut our evidence gathering and research budget down as low as we can. So we're hoping that what we currently do will help them, but if they have any specific needs of us to do more tracking, we would need to look to them to fund it.
Okay, that's very helpful. And I think we've heard this morning just in terms of the wonderful food crime unit that you do have, and just how effective that is. And I don't think we would want anything to further take away from the ability you have to do that. So thank you.
Joe Fitzpatrick.
Thanks very much. You know, I want to go back to food fortification, and Gillian, you mentioned it in response to Emma Harper's question earlier. Specifically looking, though, to hear a bit about mandatory fortification. Obviously, there's a few areas where we've had food fortification in place for a while, and recently, just last year, the mandatory fortification of non-wholemeal wheat with folic acid was introduced, and we know that the evidence for that is really, really strong in terms of reducing incidences of fetal neural tube defects. So it was really good we managed to do that. It took longer, I think, than the evidence would have suggested it should have taken, but nonetheless it's good that that was able to be taken forward. So just wondering whether there's any other areas where we think actually we need a mandatory approach. And I guess when looking at that, just if you could refer to the report on the dietary intake in Scotland's children, the DISH report, which did find a number of areas where micronutrients, particularly in the 11 to 15-year-old age group, there were micronutrient lacking. And is it a mandatory approach we need for that, or is there another way to make sure that those young people get the nutrients that we know they need?
Good question. I mean, I think just go back to the folic acid example first, just to kind of highlight that it was modelling that was done with IFSS that was really fundamental in actually pushing that forward. And we did look in Scotland to do it on a single country basis, but because of the way that the flour milling, etc., works, it's not really possible to do that. So it is wonderful that that's going to be in place and mandatory, I think, from end of next year. there are bread and flour eggs, so they also are fortified with, I think it's iron, calcium, B vitamins. So yeah, I think that's, there's a question, should we be mandatory fortifying other things? I think it's quite difficult because the way in which the micronutrients, when we've looked at some of the diets, the deficiencies come in various different ones. So it would be which micronutrient and how. And many things like breakfast cereals, which children do eat quite a lot of, are voluntarily fortified. So I think there's a lot, and there's limits to what manufacturers can add in that regard as well. So I think there's quite a lot done there. In other countries, in terms of mandation, the only other thing that's really, if you look across the world, would be iodine, but that doesn't tend to be a big problem in the UK, so I don't know that in Scotland that would be something we would want to take forward. So I think really there's probably enough already in place in terms of the voluntary fortification. I think where I do see a potential risk maybe going forward is there is a bit of a drive away, as we say, from ultra-processing and towards things like organic. Now, that would mean you couldn't fortify. So, therefore, your breakfast cereals would, for example, become less nutritious to some extent because they wouldn't have these additions. So, I think we do need to be really careful. It's not a one answer or other. I think we need to look at the things in totality. So, that is a concern for us and something we will be keeping an eye on going forwards.
Have you got any thoughts on why the DISH report showed this specific problem around 11 to 15? Is it just because at that age kids stop eating cereal and don't get their...
I think partly it's that agency thing. When children are in that sort of primary school age, there's more control, if you want to put it like that, up front in terms of what they're eating. Their parents will be providing, the school will be providing. But as you get to the teenage year, and I know I have 2 teenagers myself, they have a lot more agency and ability to forage in that larger food environment, which tends to be flooded with unhealthy items, which are attractive, they're marketed, and they're really predominant. So I think that's where we need to really, they're very attractive, and I think that's where we see that difference going forwards as the children get older. But there's also quite a pronounced difference in terms of the affluent and deprived, and it's particularly in the older children. Particularly things like sugary soft drinks are much, much higher in those children living in the more deprived areas. So there is that inequalities issue we really need to focus on too.
That's really useful. Thanks very much.
Carol Malkin.
Thank you, Convener. Thank you. I want to just ask a little bit about the Internal Market Act 2020. I know you have made some comment about it before, but just to help us understand, what do you think the overall impact of the UK Internal Market Act 2020 will be on food standards and consumer protection in Scotland? And have you had discussion or made representation to the UK Government, and how has that gone?
Ian.
So, yeah, thank you. Good question. So, Food Standards Scotland has actually already written to the convener for the Constitution, European External Affairs and Culture Committee in this respect, and made it very clear that we are of the view that the Internal Market Act actually does disincentivise genuine consensus building and creates, in our view, a degree of regulatory uncertainty. And to evidence that, we have a situation where, for example, Scottish ministers can make a decision on policy that the Secretary of State can effectively put a thumbs up or thumbs down to. So we have concerns around the accountability to the Scottish Parliament in that regard, particularly if there's a decision contrary to the Scottish Parliament. Scottish Parliament, in that there is no mechanism there to hold UK Government to account. There's no override in that respect. So we have made our feelings known. The impact in terms of food safety, there are a number of key areas where we have seen that there's a potential locus for the Internal Market Act, particularly around things like single-use plastics, the deposit return scheme, high-fat, salt or sugar food and drink restrictions, and the new developments in terms of precision breeding. And that narrative goes on. But what we are seeing is that, picking up on Gillian's example of folic acid, for example, where there is an opportunity for adherence to good policy making, you know, the requirement for the Internal Market Act is actually nullified to a degree. We don't see the added value or need for it in that respect, because good policy making would actually provide all the necessary checks and balances, and indeed not have a situation where there is added complexity for industry. We have got twin streams of communication sitting there where business has to engage in duplication with UK government, devolved nations, and the whole line of having clear guidance as well around how enforcement takes place. We are very unclear in terms of what we would advise enforcement officers in the event of divergence. You know, one area, if there's a food introduced, for example, by one country in the UK, around GB, sorry, that has a divergent approach to it, that the enforcement of that in another country is very unclear at this moment in time.
Thank you. Thank you. That's very helpful, because that's what I was going to go on to ask, is how would that work? So perhaps there's something we need to look at in that and follow up. That's really helpful. Thank you.
And Paul Sweeney. Sorry.
What's being done on SBS gives us an opportunity to look at those issues. So I think it's quite a timely time for government to raise the need to look at this Act, especially around food. I think there are other industries where they might not be so keen to revise, but with the SPS agreement, we can look at the IMA again.
Okay, thank you.
Paul Sweeney.
Thank you, Convener. Thank you to members of the panel. I know that Food Standards Scotland has had a flat cash budget settlement from financial year 22-23 through to the current financial year of £22.7 million. Obviously, real terms erosion will have an effect. So what are the funding challenges the FSS is facing, and what measures are you taking to mitigate those funding challenges?
We've worked very closely with Scottish Government to look at our current costs. And yes, the flat budget actually goes back to 2015, with the exception of £7 million that we actually got for Brexit consequences. So it's been a very long 10 years on the same funding. 3 years ago, we undertook a prioritisation exercise and cut back on everything that we felt was not core to our purpose. 2 years ago, we had a look at business as usual and took steps to make that as efficient as we could. So this year we really haven't had anywhere to go. So we have raised that with Scottish Government Health Finance, and we've shared books, and they've looked at our modelling and our costs, and there's an agreement. They recognise that we are looking at a 2.5 million budgetary deficit. So the agreement is we'll continue to look at that in year and work to try and find a solution. But we're already starting to talk about our budget requirements for next year, so that that's done before the budget statement is provided, because we just cannot literally carry on the way that we're going. Does that answer your question?
I wonder if you could perhaps develop a bit further what practical action you're taking with the Scottish Government to address that deficit. You mentioned that you're working together. I just wondered what that might look like in practice.
Well, we're meeting, I think it's monthly, with the finance team, and to review our costs as we go month by month. And just wherever we can, we've committed, like every other government, a public body to look at being as efficient and as effective as we can be. So we're committed to finding savings. But where we can't find savings, we will be raising that as an overspending issue on an underfunded budget, rather than an overspend because we're spending beyond what we're absolutely essential to do. I've also contacted the Minister to talk about our functions and how we can get a closer match between the functions that we are required to deliver and the money that we have available to spend, so that we can go through that together and be clear that we are focused on the things that government requires us to do, and that we are not straying into areas of wish rather than essential nature while we're going through this situation of being significantly under pressure for budget. And I'm hoping that there'll be some common ground where there's a recognition that we do. Our costs have gone up substantially this year, like everybody else, with employers' costs rising. We've have struggled this year. And I'm hoping that that will be recognised by some in-year resolution to that shortfall.
I think what you've said is reflected in the external audit that was published in December. Just given what you've said about potentially a planned overspend, are you confident that the FSS will meet a balance financially in the current financial year?
I believe our staff are very committed to doing what they can to keep our costs as low as possible, and also that they were raising that issue as clearly as possible with government, that there are some areas we just cannot reduce spend on without introducing risk to the food safety system within Scotland. And therefore I feel it's really important that we find jointly funding between us to meet that gap. And it is a gap. It's genuinely, I worked in the NHS for 34 years. I'm used to finding efficiency savings and doing prioritisation and reprioritisation exercises. And I genuinely have run out of ideas and suggestions. Ian's got something to add.
In terms of practical examples, so Food Standards Scotland has actually reduced our whole-time equivalent by 25 in the last year. The 35-hour working week had an impact of a 16 full-time equivalent reduction. So we've got an 8.8% decline in a one-year period. And taking the totality of the conversation we've seen, we've already mentioned that we are a relatively small organisation, but with an extremely broad remit. And it's at a time when our food system is under even more scrutiny than it's ever been before. This year alone, we are hosting 12 other country missions to look at the system of food controls that we have. And we have to support that. EU exit has meant that the EU are coming in to look at dairy, they're coming to look at shellfish and the system of control around that. And essentially we are having to prioritise. Heather mentioned the prioritisation exercise we undertook a couple of years ago. We're doing that almost daily, weekly, through the lens of what is affordable and equally what presents risk, both in terms of trading risk and public health. But there's absolutely no doubt about it. The duress that Food Standards Scotland is under is extremely real.
Appreciate your candour in that regard. Thank you very much.
Can I just take us back a step to the discussion we were having on the Internal Market Act? And you, in your evidence, your written evidence to the committee, you raised the issue of potential prospect of precision bred food and feed products being authorised in England but not elsewhere in GB, but nonetheless being placed on the market by virtue of that Act. Can you perhaps share with the committee what some of your concerns were about that?
It's as simple as that override point that ministers here could consider that proposals for precision bred products do not meet ministerial expectation here. But the Internal Market Act is that if it was considered acceptable for laying on the market elsewhere in the UK, then that would override. Despite, for example, ministers here being presented with sound evidence to the contrary, and your decision-making follows that, if there's an alternative approach taken elsewhere, then that thumbs-up, thumbs-down approach can very firmly be taken, and the products would trump any other approach. Previously, prior to the Internal Market Act, you would have had sound policy discussions at official level that would seek consensus before any, and it would inform any regulation development. That is now been overridden by the IMA process.
So, I suppose in your specific example you'd given about the precision bred food, could that then also affect things like GM products that perhaps Scottish Government did not want to have on sale in Scotland, or other food products that perhaps in this place, in the Scottish Parliament, we had decided that we did not want them introduced into the food chain?
So, again, going back, there are some exemptions within the Act that could offer some protection there, but the general kind of principle is that that if a policy has been assessed in line with good policy-making practice, then the outcome of that process should be respected, is our view. But if an alternative view is taken by ministers elsewhere and that product is produced or imported in and accepted to the standards of another devolved country, then it could appear on the market here.
Patrick Harvey.
Thanks, Convener. I also just wanted to come back in on the Internal Market Act. Just to be very, very clear, I was opposed to the introduction of the Internal Market Act, as the majority of the Scottish Parliament was. The majority of the Scottish Parliament supports its repeal. And I would like to see that, but I'm realistic enough to know that the current UK government does not intend to consider repealing it. And we're going to have to make the case for some kind of changes in the review of the IMA, which are short of that, which would respect the democratic will of the Scottish Parliament. What kind of changes do you think would allay the concerns that you've expressed? For example, the exemptions process from the IMA is at the moment completely undefined. It's at the discretion of UK ministers. Would the addition of specific exemption criteria, which is similar to the way that the comparable EU legislation used to work when we were an EU member, would that address the concern if, for example, policy intended to achieve a public health outcome was granted an exemption on virtue of satisfying that criteria, rather than simply being a matter for the Minister of the day to make an individual decision about, which leaves us with the current lack of clarity?
That's a good question, and I think that the board in our discussions have said that if we had a preference, we would like to see the UK frameworks being the policy method that was used for changing food standards or food law in the UK on a Four Nations basis, to make it far more easy to not just regulate but to actually enforce any failures. So that would be one. I think the exceptions, yes, I think we would be aiming to see at least what we had under the EU as a written exception, to be able to protect for public health reasons. We work very closely with FSA. So, for example, on precision breeding, while not compromising our position that this is not something that is being taken forward in Scotland, we have tried to influence FSA through joint working on what's required in secondary legislation, etc., to try and make sure that we're protected as much as possible. So we use our policy and science people to try and influence the work that goes down in London, where it influences Scottish food. And we've been doing that for the last couple of years, just to try and make sure we're mitigating as much as possible the steps they take forward. But we are still left with that problem about, because it's on the shelves through English law, we cannot enforce English law. We can only enforce Scottish law. So there's still that gap, which I think is wrong, and I think that that needs to be addressed through this forthcoming discussions on an SPS agreement, because if we are going for dynamic alignment with the EU, it gives us an opportunity to look at what the Internal Market Act, how that would prevent that from really working well, and how we can then put a new process in place that allows us to do that more efficiently and effectively on a Four Nations basis, where all views, all interests are considered at one point, and we can move forward on that basis.
Yeah, so it's very specific.
So IMA exemption criteria would be helpful. You were also asked earlier whether you've reached out as an agency to the UK government to set out your position on the IMA. I would frame that question the other way around. The UK government, in considering the future of the IMA, ought to be reaching out proactively to all public bodies with a responsibility to look after the public interest, including public health. Has there been proactive engagement, even at official level, with yourselves from the UK government?
I mean, yes, we are engaging well with UK officials, but it still has resulted in the current situation where Scottish law can be disapplied by virtue of the IMA. You asked specifically as well, just going back to your previous question, that the application of the market access principles we think should be suspended for goods, and that the frameworks approaches really should be allowed to run their course, and that would provide the UK government ultimately, as we have been saying, with an evidence base which would really allow them to legislate accordingly if actually it was considered necessary. But we are engaging at official level, but you can see where we're at the moment.
Okay, thank you very much.
Yeah, thank you. Can I just, to you, Gillian, just to say that if we're going to tackle our significant health and nutrition issues that we have in this country, even our climate change issues we have, wouldn't one of the simplest things we could do is just promote a homegrown, locally produced diet?
I wouldn't see any reason that would be. I mean, I think the difficulty with that is how achievable is that for the entire population. I think that's where we've got to sort of think about it. It's not to say that that's not something we would want to promote, that a homegrown situation would be ideal. I think we need to look at the totality of what is produced. A lot of the food that we eat in this country is imported. So why is that? There's partly because things can't grow here, but partly because that's what the public want to eat. So I think there's many complexities around it. I think anything that we do, we need to be very mindful of inequalities, and that's where I think some of the difficulties are in terms of those people living in the areas of social deprivation. It would not be such an easy thing to take forward as other areas, for example. So I think whilst in essence that I don't have an issue with that. I think we have to be careful to make sure we look at the population as a totality and take measures that do improve everybody's diet. And I think those upstream systemic measures, so the food environment, things that the food that's produced and is available needs to be made more affordable and more available to everybody.
I would add to that we also export a lot of our food.
There's that other part of the coin as well that we need to be mindful of. Yeah.
Thanks. It's just a quick question. It's kind of going back to food crime. Is it a big problem? What do we need to do to tell people in Scotland to be aware of? I know there was an issue last September in Coatbridge with the counterfeit vodka. So basically, how do we help support people to identify if fake vodka is out there?
So, happily, the vast majority of the food that we eat is what it says it is. It's high quality, and that food fraud is something that we see as prevalent. I mentioned already that whenever we've turned a stone over in investigation or intelligence lines provide for, that we're finding something. Sadly, there is no system of control anywhere globally that would absolutely guarantee that you could prevent crime actors from subverting that level of control. So we have to be active in our development of surveillance and intelligence and sampling, and that's the bit that's under duress at the moment because we're clearly doing very much less than we used to. The success that we're enjoying is around the development of the kind of theme of food crime. Before horse meat, you would never have heard of the thought of food crime. So it's new in that sense. But we are actively investigating, actively promoting, developing tools. So we have our food fraud, food crime assessment tool, food crime hotline, and we're doing all we can through the channels that we can afford to promote engagement with that. So we've actively been engaging with food business to allow them to undertake an assessment of where they see themselves at risk and what actions they can take accordingly. I would very much like to be in a position where we could do more, but we are taking very clear decisions on intelligence leads as to what will give us the biggest bang for our buck. Investigations in this space tend to be very complex. They're multi-agency, so the vodka case that is still ongoing, that involves serious and organised crime behind it, potentially, that we have to be sure that we are taking the appropriate action. It may actually not even be under food law that these cases are prosecuted. Common law can have a much greater sanction penalty tariff attached to it. So we're doing a lot to boost the concept of food crime. We are a thought leader. In fact, our team are actually working with the Global Alliance just now. It looks as though that we have managed to, we're chairing it, the Global Alliance currently, on food fraud and food crime, and it looks as though we've been successful in getting the European Food Fraud Network, part of the EU, to become part of something that we created. So again, we're a thought leader in this, and again, the concern is that we are throttling what we do simply because we don't have the resource to do any more. Scottish produce is a world brand here, and as we've seen from horse meat in particular, it can be in a very precarious position, particularly undermined by food fraud and fraudulent actors.
Okay, thank you.
We do actively encourage whistleblowing, and we used to advertise our Crime Stoppers approach for the public to report or employees in any food business, and we strongly encourage people to do that. It would be good to be able to promote that a little bit more again. And we've created tools for businesses to assess their own food supply chain for risk in terms of food crime or fraud. So we try and do things to enable the businesses to take more responsibility in checking their own food chains. But it's something that, as Ian said, we've been surprised quite a lot about how much we have uncovered. But the intelligence team that we employ are incredibly astute at what they do, and our enforcement team are excellent. So we do our best with a small but effective team.
Okay, thank you. Thank you. Can I thank the witnesses for their evidence to committee today? We will continue with our work in public. If you wish to leave, you're free to do so. The fourth item on our agenda today is to consider the following negative instrument, the Health Board's Membership and Procedure Scotland Amendment Regulations 2025. Regulation 3 of the Health Board's Membership and Procedure Scotland Regulations 2001 provides that at least one of the persons appointed to be a chairperson or a member of the boards in Grampian, Greater Glasgow, Lothian and Tayside must hold a post at a university with a medical or dental school. The purpose of this instrument is to add Fife Health Board to that list. The amendment follows from the University of St Andrews Degrees in Medicine and Dentistry Act 2001, ASP 13, which restored to that university situated within Fife Health Board area the power to award degrees in medicine and dentistry. The Delegated Powers and Law Reform Committee considered the instrument at its meeting on the 27th of May 2025 and made no recommendations in relation to the instrument. No motion to annul has been received in relation to this instrument. Do any members have comments? No. I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? Thank you very much. At next week's meeting, we will take evidence on welfare and sustainability in Scottish youth football, and that concludes the public part of our meeting today.